Hi. My frustration with this whole debate about health care continues to grow. I really went over the top, though, this morning when I saw a replay of Jimmy Kimmel's tearful, emotional talk to his audience last night. It lasted about 10 minutes. He was explaining that he just had a new baby and the baby had a horrible heart defect. And he spent all of this time thanking the people who had helped him, all of the medical people and all the staff and everything, even his family. And of course the audience loved it. They were cheering him on. And it was very emotional, and everybody could identify with what a parent must go through when a child is suddenly hit with a very terrible illness. As I watched all of this, when it was all done, the one thought that ran through my mind was, oh, cry me a river. Now, before you all write me angry emails, let me finish up what I meant here. I have sympathy for the thing he went through. I have sympathy for his child. I'm very glad that everything worked out okay, thanks to the exquisite medical care that he got. What was missing for me in his talk was something about how you pay for all of this. No content at all about how much all of this cost. My guess would be that the incredibly top of the line medical treatment that his child got must have cost $500,000 at least. Who paid for that? Well, of course, it was his insurance company, his healthcare insurance company. And you can bet that Jimmy Kimmel has a top-of-the-line healthcare insurance company watching out for him. Of course, he is an extremely wealthy, very, very successful late-night show comedian, white, and so it went great for him. Who can complain? The audience all applauds. Yes, we all want health care for everybody. We do, yes. Of course, no talk at all about how we're going to pay for that. That's what made me angry about this. Let's think for a minute about the same situation, except the patient whose new baby has this horrible heart defect has dark skin. And let's also say that this dark-skinned parents come in and the father works a minimum wage job for $12 an hour at McDonald's, let's say. What do you think the chances are that that family would get the same kind of care that Kimmel got? They might even have healthcare insurance, but their deductibles, because they can't afford a very good program, their deductibles are maybe $50,000. If you're working at a minimum wage job, you don't have $50,000. My point here is that this seems to be again and again and again the thing that we're hearing is how in this healthcare debate, the insurance companies have to make money. They have high-paid executives, they have shareholders, they have huge advertising budgets, and that's where they have to make their money. I watched the other day in horror as on CNN, a congressman from Pennsylvania, a Republican congressman from Pennsylvania named Mike Kelly was being interviewed. And he explained in a kind of condescending way to the interviewer that, well, you know, this is just a business decision. And if you have very high-cost patients that have pre-existing conditions, like Kimmel's baby did, then the insurance companies have to charge more because otherwise they're going to lose money on the deal. In watching this interview with Mike Kelly, my hair was on fire. I could not believe his attitude. He was so patronizing to the interviewer, explaining about how business works. And he said something I want to read to you word for word. He said, "The greater the risks, the greater the premium. You see, honey, this is a business decision." Well, Mike Kelly, let me tell you something. That's the way business works. And business has no goddamn place in healthcare. Get out of it. Let it be run by the government so doctors can practice medicine instead of filling out a lot of forms. And let's upgrade our entire healthcare system by getting the profit motive out of it. That's my message for you, Mike Kelly, Republican from Pennsylvania. And that's what we see going on in Congress right now, is a fight over how much money is going to be lost and who's going to get screwed in the deal. And I'll tell you who's going to get screwed in the deal, and I guarantee you this, it's the people at the bottom. And the people at the top, the money's going to flow right to them, to the big insurance companies, the executives, the shareholders. They'll do just fine. But it's the people at the bottom that are going to get screwed. I'm fed up with this. I think it's about time that we stand up for a single-payer healthcare plan. Get rid of these healthcare companies and have a government plan that would be paid for through our taxes. After all, if we consolidate all of our efforts, we should be able to help people that don't have any money get good health care just the same as people who have a lot of money. What's wrong with that system? So I urge you to think about how can we move our health care debate out of this whole issue of profit. Profit motive has to be profit. And think in terms of a socialized model where we're all covered because we all pay taxes. And it doesn't matter if you're a young person and healthy and you say, well, I don't have to. Why should I buy health care? I'm young and I'm healthy. Oh, bullshit. Come on, this is not the way it works. Everybody pays, whether you're young and old and in poor health, or you're young and healthy and you have money or you don't have money, we all pay into a common fund and we're all covered that way. By the way, it's exactly how car insurance works. If you're a very good driver, they don't say to you, well, never mind, you don't need car insurance. The state mandates that you have insurance. And that's the way I think we should do it in this healthcare program. Now, I am very happy that everything turned out good for Jimmy Kimmel's baby. But what I'm irritated about is we are still living in Never Never Land. The audience all applauds. Oh, yes, yes. Oh, we all need good health care for everybody. Yes, yes. By the way, how are we going to do this? Because as far as I can tell, these healthcare insurance companies are greedy bastards who want it all, going to go right to the top for them. And the little guy, my mythical $12 an hour McDonald's employee, yeah, good luck with your $50,000 deductible. So let's make some noise. Let's let people know that we're sick of this for-profit healthcare system. It's about time that we pool our resources and take care of all of us all together. Thanks for watching. Hope it didn't piss you off too much. Maybe even agree with me. Wouldn't that be great? Drop me a note. Let me know. Thanks for watching.